how do you know which clinician is right for you? Now, we are very fortunate in our office to have a variety of levels of clinicians to help meet your needs. Choosing a clinician is absolutely a personal decision, and our administrative and intake staff will assist you with making the right choice. We take into consideration your current level of needs, your personal requests, your schedule, and also maximizing any insurance benefits that you might have as we make a recommendation. The clinician's current caseload and schedule availability is also a factor that we consider. So here's a little bit about the different levels of clinician that we have. Keep in mind that the levels of clinician doesn't affect their level of care for you. It just describes their level of experience and or education background. So to be an intern, we have interns in our office. Your clinician has completed at least a bachelor's degree and is in the process of completing their master's degree. That means that they've applied to and been accepted into a master's degree program. They've taken some introductory courses on counseling theory, practices, and they've also been supervised by our clinical director prior to being able to take on sessions with you. They also are being supervised on an ongoing basis by their direct supervisor, their clinical supervisor on our staff, and also on their instructors on their campus of record. So it's important to remember interns are still students. While they're not yet licensed, our interns do have a variety of experiences. Many of them have worked in the community for years in a variety of kind of social service or personal care roles. So they do have a lot of experience. And they have to show that evidence of clinical competencies before we allow them to take on any clinical caseloads. Their services are provided to you at a slightly discounted rate to account for the fact that they are still learning on the job. Now, an associate licensed clinician is a little bit different. So to be an associate licensed clinician in our office, they've completed all of the academic requirements for their master's degree. They now have received what's kind of their first layer license from the state, which is an associate license, which requires them to acquire an additional associate license hours. In this state, that's about 2,000 hours, which means that they have done lots of clinical work prior to getting to the associate level, but they're just acquiring even a little bit more. So our associate level clinicians have all of their clinical records reviewed by our clinical director, and they also generally have a direct supervisor. They have the benefit of collaboration and staffing with anyone in our office, and they also have a variety of experiences. Our office also employs coaches. Now, to be a coach in our office, your provider has completed a master's degree in a behavioral health science, which may have included both practicum and internship hours, similar to our associate licensed clinician. They also have completed a certification in their preferred method of client care. While coaching is not license eligible in this state, your provider does align with the clinical and professional guidelines of our office. They also have access to all of our clinical staff for collaboration, and they will refer you if it's deemed necessary. Now, the majority of our clinicians are what we consider master's level clinician. To be a master's level clinician in our office, your clinician has completed both their bachelor's, master's degree, including practicum and internship, and all of those 2,000 clinical hours during their associate license period. They now have a full license by the state of Indiana, meaning that they are able to practice throughout the state with no supervision. However, in our office, all of our clinicians do have access to that clinical director for any questions and clinical collaboration during those weekly office hours. Your clinician may also have additional certifications or training or experiences in addition to their traditional academic degree. In our office, we also have PhD level clinicians. To be a PhD level clinician in our office, your provider has achieved a doctorate degree, which includes practicum, internship, and an advanced internship as well. They have completed well over 2,000 clinical direct hours. Many have also taught other clinicians, so they have a wealth of knowledge and experience that they bring to the table. In our office, while they're not required to be supervised, they still maintain access to that collaboration and personal growth through both communicating with our clinical staff as well as our ongoing commitment to professional growth experiences. Your clinician may also have additional certifications or training, such as EMDR or other certifications, in addition to their traditional academic degree.